Uh, I'm just discussing some other thing than pure studies, and this is about the future perspectives in different from different countries. Things are a little different. My main focus will be towards the people who are having a scholarship program to Ireland or UK. But if some people from other part of the world, it is for their interest as well, because a number of things are common for anyone coming to UK or Ireland from any part of the world. Okay, because their training system is apparently welcoming for everyone, but I think it's not easy to get a training position over there, and it's really hard to become a consultant over there from wherever part you are moving to UK or Ireland. Okay, but yes, if you have the commitment and you have the you have the ability, uh, you will be able to get it. But you should, once you are planning something, you should be knowing about all the pros and cons. Unfortunately, the people who are not there, who are not working there, have a lot of confusions about their system. Okay, especially because I tell you that some, because I again tell that I will highlight to, especially to the people who are coming from Pakistan, and they are like having a lot of confusions, and they are thinking that going to Ireland on this CPSP College of Physician Surgeons scholarship program is something sending them to like taste of heavens. So unfortunately, it is not like that. Okay. So please, can you mute your Dr. Fariha, if you can. Okay. So first of all, I will just take few minutes about this scholarship program. And their criteria is that they are appearing in the intermediate module exam of the fellowship from the College of Physicians and Surgeons. And then when if they are passing that exam in first attempt, and there is some criteria, CPSP will be considering some of them and sending them to Ireland. Okay. So first of all, the thing is that there are so many things which are making it, I will tell the good things first, so that you know the good things, and then, because there are only few good things and a lot of things which are making it useless actually. Okay. Sorry to see this cricket match going on in the background. Okay, just a second. Okay, can you see the screen? And at any point, if you want to ask any question, just raise the hand and I will take your question. Okay. So first of all, there are good things that if you are coming from Pakistan or India or African country, or any part of the world, of course, the system in UK, I will be concentrating on Ireland first, but a number of things will be alike. The system is organized. Okay. So this is one thing. They have protocols. Okay. So, and they have they are trying to, they have like a better environment of work ethics. There are specific work ethics. Okay, the facilities are there. Okay, and the logistics are there. So these are the things, you can label them in a different way. They are getting some access to the journals. Okay, they are having some advantage in getting introduced to the consultants over there, and for they have some exposure. Okay, good exposure. So, but the thing is that, for example, if I tell that these things you can get even if you are coming after finishing your fellowship, okay, and you are coming here to stay here for a longer time, because this scholarship is for 2 years. Okay, There are a lot of limitations. First of all, now I will start telling the bad things, that around 1 year, because this is after second year, you are appearing in the intermediate module once you pass it, and around 6 months to 1 year, 12 months. I'm like, it depends on scenario, but I think if I'm not wrong, I'm sorry, someone can correct me, around 6 to 8 months to have the whole procedure. Okay. So actually third year will finish. And once you reach there, because this program is for 2 years, so actually you are wasting almost 1 year of your life, because you will have 2 years extra like over there. So at least 1 year you will lose. Okay? So even if you are reaching at the start of 4th year, you will still have to complete 2 years more. So the time is money. Okay. So you are wasting very, very precious time. Okay. So this is one thing. Number 2 thing is that whosoever is going to Europe, one of the reason for going there is to get the passport. Okay. So if, for example, you are going there and coming back, actually you are losing your time. I'm not sure about this, 100% sure about this answer, but I think you need to stay there in sequence, not like you go there for 2 years and come back, and again you are coming back once you finish, because there is an obligation that they have to come back to Pakistan. They have to come back to Pakistan and then they can go back. Okay. So actually there is waste of time. This is one thing. And okay, forget about this thing. Even if we say that this is not an important thing, the main thing is that what will you get? What will you get? The skills. Now we have a global world. Okay. So even if you don't have the facilities at your workplace, a number of things you can learn by watching the videos. By at least you should be at this stage of your career, if you are building your knowledge, that is more important than anything else. Even if we give fiber optic bronchoscope to a monkey, he will not be able to intubate till the time he knows about it. And if you are using fiber optic bronchoscope or any gadget, ultrasound or anything, without the knowledge, actually there is not much difference between you and, okay. So understand. So this is very important. We forget something, that the more important thing is that you should have the knowledge. You should have the troubleshooting. You should be knowing how it works. Yes, of course, practical things are important. I'm not saying that it can bypass if you don't have the ultrasound machine and you are only reading about it. Yes, it's not a replacement, but still there is a lot of things which you can learn by watching the videos, by having the knowledge. So this is not an explanation that if you don't have good ultrasound machine or you are not getting the chance to have the blocks, it is end of the world. It's not like that. You should have a very good, thorough knowledge. You should know all the protocols, ethics, a lot of things you can learn by. That's why I am preaching everyone to have the articles like BJ education articles, anesthesia tutorial of the week articles, and a number of articles which I have. Actually, a number of sources are paid and I have paid for it, and I'm not getting anything out of it, and it is for all of you. Okay. So the thing is that what you can do, even without going to Ireland, that you can learn all the guidelines which are there in the AAGBI. You don't need CPSP scholarship to read these protocols and guidelines. You don't need CPSP scholarship to have this access. Somebody told me, oh, we will have free access over there for the resident. That's why I want to go to Ireland. I told I have the access. I will give you the access. Please don't go only to get the access over there. Or some people tell me that they are getting some advantages when you are competing for the training. So actually thing is that someone can disagree with me that it is really, really near to impossible. I'm writing it I am possible, because maybe there is some way, but it is almost impossible to get training in Ireland. Okay. There is some chance to get training in UK, but still it is very, very difficult. Okay. So first of all, remember one thing, because the training system in majority part of the world is a little bit like Pakistan, we have exit system. Okay. So once we have all the training requirement completed, only then we are same system. I know that same system is there in in India. I think same system is there in number of countries, that these are exit qualifications. You are fulfilling all the requirements, and then even if it is MCPS or it is DA or it is DNB or it is MD or it is FCPS or it is MCPS, all these degrees are exit qualifications. You are fulfilling all the requirements, training, whatever criteria they have, and then after that you are appearing in the exam, and after that when you pass it, they give you the license to kill. Like you are officially, legally, you are authorized, and you have the permission to give anesthesia. Okay, the UK and Ireland system is not like that. UK Ireland system, because people are asking, first year resident, sir, I want to do FRCA, and there is so much hope. It is just like it is something out of the world. EDAIC. Oh, sir, you have all these exams, ADRA and EDIC. I can tell you a long list of degrees, FIPP. Okay, European Diploma Pain Management. This is Philo Royal College of Anesthesia. This is Fellow College of Anesthetists Ireland. This is European Diploma in Anesthesia and ICU. This is European Diploma in Regional Anesthesia. This is European Diploma in Intensive Care Medicine. This is Fellow Interventional Pain Practice. This is USA. Okay, this is European Diploma in Pain Management. There is, I don't remember exactly. There are 2 degrees of pain in UK, one in pain in Ireland and pain in UK. And similarly, there is 1 ICU degree in Ireland and 1 ICU degree in UK. These are separate from these. Even if you have 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, dash, 100, they are equal to 0. If you don't have what thing? If you don't have the CCST. Okay, this is the master. This is the training certificate. They will ask you, okay, empty your pocket, empty your brain, read, pass the exams, become master of knowledge. And unfortunately, there is no guarantee that you will get the training. This is their answer. Okay, because they are not your uncles. They are not your fathers or mothers or brother or sisters that they are interested in training you. Yes, if you are very good, they want to utilize you, only then they will give you a training. And if I apologize if someone over there disagree with me, but I am speaking out my heart. Okay, because this may be listened by people who are working in UK, Ireland, or they have different ideas. So I have never worked in UK, and I have never worked in Ireland. I have passed this 1, 2, 3, and one more French diploma regional anesthesia. I have passed these 4, but I am consultant in Saudi Arabia on the basis of my FCPS, because this is an exit qualification. There is a training. There is a 4 years training program, and I'm proud to say that I am consultant in Saudi Arabia
not on the basis of this thing. This is just like sweet dish. This is just like garnishing on the beautiful, like you are making your dish very beautiful, or this is just like a sweet dish. This is not the main meal. Remember, this is not the main meal. So I hope you understand that this is called as certificate of completion of specialty training. Ask anyone who is asking you to go to Ireland or UK, first of all, forget about these 101 degrees and concentrate on what is CCST and what is CESR. Certificate of Equivalence of Specialty Registrar, or maybe abbreviation is something different. So you can say the people from India, they will understand this is more, this is Brahman and this is Shudar. Okay, so this is the superior and this is the inferior. This is what I think people from India, even Pakistani people will understand. People from African country or any other, this is, you can say Mia Mia. If Arabic country, this is Mia Mia, and this is 50-50. Mia Mia is 100 by 100. Mia is 100. Okay, so this is the thing which they want. Even for example, if you have CESR, you can compete in UK or Ireland. I will tell you how to get CCST and how to get CESR. But thing is that this one still not make you qualify to, because people are very eager to know about their futures in UAE or any other part of world. Majority countries, maybe some countries will accept it, but I think 80% people, if I'm giving very liberal, I think it is not even 80%. It should be less than that. They will not accept CESR. They will only ask for the big boss. So this is still unhappy person. Despite all the havoc he will have to face in UK or Ireland. After that, even he is inferior. He is not Barhaman. He is not 100 Mia Mia. He is not Mumtaz Jiddan. I'm just using, but maybe someone else is. This is khwari.com. If the people, okay. So this is, now I will tell you how to get it and how to get it. It is almost impossible to get it in Ireland. Their system is different. They are not welcoming anyone from outside. So it is almost impossible. Maybe there is some route, I don't know exactly, but it is near to impossible. I'm kidding. In UK, there is a chance that if you are extraordinary, you are competing, and then maybe you are able to get it. Now comes to CESR. The CESR pathway is easier in UK because exactly because I have not worked there. So I will tell you the basic concept, and you can get the further information directly from the source, from the people who are in UK or Ireland. They can tell you. For Ireland, it is roughly you can say around 6 to 7 years, because they are considering less of the training from outside, and they are asking you to complete. What is CESR? That you have, they have certain training requirements, certain number of cases, certain, like they have A, B, C, D, X, Y, Z, their requirement. You have to tell them, and you have to prove that I have done this thing in last so years. Or so what is the problem now? That you have to finish, roughly it is not 6 to 7 years exactly, but it takes at least 6 to 7 years to complete it. Why? The reason is that all the rotations in UK Ireland is usually 6 months to 1 year. Okay, there may be permanent jobs, but usually it is 6 months to 1 year, and not all hospitals are having all the rotations. So maybe they are still the thing which I know, that the pediatric rotation is very hard to get, the thoracic rotation is very hard to get. Okay, so what happens that you are not able to get it, even if you are working, if you have finished all the rotations, you are competing for ped and thoracic, and you are not able to get it. So it will take time, and you after every 6 months to 1 year, if you're like, you have to relocate, maybe or maybe not. Maybe you are in the same city, maybe you are relocating every 6 months to 1 year, because there is no guarantee that your job is confirmed over there. Maybe they are working for some time, different time, but there is an option that after 6 months to 1 year, you need to relocate. And there is no guarantee from the college. This another thing I want to clarify, that the registration body is IMC in Ireland, and GMC in UK, General Medical Council and Irish Medical Council. This is different from the College of Anaesthetists, which is Royal College of Anaesthetists in UK and College of Anaesthetists Ireland in Ireland. Okay, so this is registration through the college, and you have to prove you have to fulfill their competencies. It is called as different words they are using, rotations, competencies, whatever. Okay, but usually practically it takes, whosoever is given, not everyone will be able to get it, but even if they are getting it, it will take 6 to 7 years, around 6 to 7 years. Yes, it will be a package deal. If you are young, you are going there and you don't have any other stake, and you are young still, I say, you are around in 30s, you go there, stay there, forget everything, stay there, you will get it, most probably. I'm not saying that it is unwise not to try for it. You can do it, you can try it, you can do it, but it is not so easy, especially for the people now who are in mid 30s or late 30s or early 40s. Like I am 42, so it is not worth for me. Okay, and I will, even with I told you all the bloody qualifications, they will say, thank you very much. We honor your qualification. Come and work as a registrar. Okay. So not everyone will be happy or comfortable like me, who is working as a consultant here, to go there and to work in their system. Okay, as a registrar, it is not so easy. Okay, so this is the problem. So now people who are going there and coming back, remember one thing. If, for example, if CPSP they are able to get you any advantage or any plus edge, or they guarantee you, or they even not guarantee, even if you are able to pass, the people go there, pass their MCAI exam, and they also pass FCI exam, and they are thinking they have conquered the world. Believe me, again, I'm telling you, this is nothing. I have myself passed FCI because I was, and if you pass FCPS, you will be exempted from MCAI. I directly appeared in FCI. I have passed it. It is a wonderful exam. There is nothing wrong with it. But the thing is that there is no advantage. What are you getting? There is no advantage. There is no much advantage. Even if someone has not passed the exam early, he can take some time, he can pass it, and still he has to pass through that circle of 6 to 7 years. Okay. And there is no absolute guarantee. There is still, maybe you can say 98% chances that you will become consultant, but still there is 2% chances. I'm very liberal, and you will have to suffer a lot. If your kids are growing and you are thinking about their future and you want to save the money, then it is not a good idea to go there. And or if you are going, you should have clarity in your mind what for you are going. Okay, so what I was saying, that if CPSP has some discussion with this College of Anaesthetists Ireland, okay, especially we are talking about anesthetists, so if they are getting any superiority in their training system, if they are accepting some of the rotations, the thing is that then it is advantageous. But unfortunately, if they are not getting much of the advantage, it is not worth to go once, come back and go again. Okay, so I'm not saying that it is totally crap. It is not totally crap, but it is not worth you. You are superior than this thing. CPSP is not offering you something out of the world. By the way, remember, you are supporting their system. They are having trained donkeys to work in their system. Believe me, because they know that if they are coming after, so what is the bad effect of it? That IMM, just few words, that intermediate module should be a dress rehearsal for the final exam. And now what is happening? Tomorrow at 3 p.m. Pakistan, we will have session for this these pool recall MCQs like we had last Saturday. So now people are afraid, running to pass the exam because they want to touch the heavens, because they want to touch the heavens and they want to pass the IMM, so that apply for CPSP scholarship. They don't understand this thing, that if they are compromising their concepts, they are just running to pass this bloody exam. What are they getting out of it? They will get the CPSP scholarship at a bad concept. What is the advantage? Intermediate module should be taken as a dress rehearsal of the final exam. And whosoever is first year, second year resident, I request you, make yourself ready. When you want to appear in intermediate module, only appear when you think that you are okay to appear in the FCPS exam, in the final exam. And this message is for anyone. If, for example, you are in India, or you want to pursue your career in UK, the number of things are common for you. Concentrate on your exam, and when you are preparing for your exam, read all the guidelines, all the articles which they require. Read about their incidents, so that when you go there, it's your second nature, and it is not difficult at all to do it. And remember one thing, then you will not need any so-called textbook. There is no concept of textbook in anesthesia. Mind it. There is no concept. I can have a big debate on. I know that 99% of senior professors disagree to my point, but I can bet on it that if you are reading these review articles, BJ Education articles, and there may be a number of sources, BJ Education, Anesthesia Tutorial of the Week, and you are studying topic oriented, you don't need these books, because anesthesia is a different specialty. Anesthesia has very few words of anesthesia, and it has everything other than anesthesia. Except for dermatology, just tell me one thing, which thing is not included in the bloody course of anesthesia? Even if you should be knowing what is MRI, what is defibrillator, what is electrical safety, how the current is passing through the body. Just tell me what is left. You are reading physiology, which you read in first year MBBS. You are not reading anything new. You are reading it for 20 years, 15 years, 10 years since your start of your medical school. So nothing is left. So if I can guarantee you, when we start MBBS, thyroid gland was, believe me, trust me, thyroid gland was still in the neck and it was secreting thyroid hormones. Okay. And still, after 20 years in FCPS or MCPS, still, believe me, thyroid gland is still in the neck and secreting thyroid hormone, not aldosterone. So come on. What do you think that it will be different in anesthesia books? There, I repeat my words. There is only few things which is in anesthesia, which are related to anesthesia only. You need to know what is medicine. You need to know what is the anatomy of thyroid. You need to know what is the physiology of thyroid, how thyroid gland is controlled, secretions are controlled. What is the nerve supply of thyroid? What is the arterial supply of the thyroid? What is the extent of the thyroid? What happens in hyperthyroidism? What happens in hypothyroidism? What are the clinical investigations you do it? How to interpret the thyroid function test? Okay, so my request is that please try to understand this thing. Prepare yourself in a way that all these exams become easy for you. Okay, so this is my humble request. I hope you understand that you should be, like, I'm just summarizing what I told you up till now, that if you want to go there, you should clear thing in mind. You have to struggle a lot, 5-6 years at least. You will have to work there. You will have to understand their system, and then you will have to prove your worth. In our part of country, there is no aptitude test, unfortunately. Especially in our part, if anyone is passing FCPS part 1, he will get training in Pakistan anywhere. And what is the status over there? People are, though there are two sort of people, one who are young, have very good cramming skills. They are reading the recall questions of pathetic SK and Asim Shoaib and Rabia Ali and Namurad. When I was appearing 2006, there was a book named Murad, which I named Namurad because it was a crap book. And I know that even more crap books are in the market. People are reading from that FCPS part 1 and they are getting the training. This is different from there. They don't accept this thing. They say, okay, we will judge you. You will judge your attitude. You will need to sign the competencies and you are good enough. Yes, we will offer you the training, but it is very difficult. It's not like Mamaji's ghar, Mamaji's home. It is not your uncle, like you're entering in your uncle's home. It will be really competitive, but still you can do it. Okay. So please don't run for IMM, passing IMM and getting the touch of heaven, Nauzubillah, CPSP scholarship. It's not worth at the cost of making disastrous concept. Take your time, study well. If you are happy, if you are very good, if you have very good skills, and then you are appearing in the exam and you are passing it, there is no problem. Okay. So any questions up till now, please? Yes, even dermatology. And I would like to listen from you. Please speak out anything. Yes. What if someone doing MCPS and get GMC by passing PLAB and then prepare for primary FRCA? Is there any chance to get training in UK by passing FRCA? Abu Bakar Bajwa, your question is very valid. And the people who are running for EDA and people are running for FRCA primary before getting GMC, it is not worth. I suggest anyone from any part of the world, if you want to go to UK, the easiest exam is this lab, because you still have to do the OET or IELTS at a very good scores. Otherwise, you cannot get the GMC. Even if you try to pass primary FRCA while working in Nawab Shah or some very small city of North India or South India, Lucknow or any place, unfortunately, I'm not saying that you cannot do it, it's impossible, but it is very difficult. Till the time you are not working in the system of UK, primary FRCA is not an easy exam. Primary FRCA is a hell of exam, believe me. Primary FRCA is not at all an easy exam. I passed Irish exam and I stayed there for 1 week staying with the people who were preparing for final FRCA in UK, in Liverpool. Okay, and believe me, I respect them. But though I have a lot of disagreement, because the things which they are asking in primary FRCA, sometimes that is too much. That is practically not of any use, but still they have maintained a standard, and it is not easy. Yes, once you are there, it is. I will give you as an example that once you are in UK, you are just like you. There was a train in front of you, and the door was automatic, electronic. You reach even before reaching there, you put your stick or your hand or your foot there, the door did not close, you enter there, you reach inside. Now the whole of the train is full, you don't have any place to sit, you just stand holding the side stick, and after some time you get the place to sit. Or maybe you don't, you may need to stay for 10 minutes or 10 stops you are standing. It is just like that. This is the same example which I am telling you, that if you want to go there, stay there for some time, you will have fair chances. But it's not so easy, my dear friends. So if you want to go there, and if you have the knowledge and concept that you are not able to pass FCPS part 1, what are you expecting? The people from MCPS, there is few words which I would like to tell and speak out loud and clear. You know, there should be ban on MCPS for people younger than 40. It is a crime. I'm using the word crime. And unfortunately, because our people, they don't think, and though they don't think about others. They are only thinking about filling the position in their hospitals. I'm really sorry. A number of people will disagree to me. Oh, we don't have any people, we need people. Yes, no problem. Make quality. Quality is equally important than quantity. What if you are making MCPS people at the cost of their, if, for example, if you are not able to pass FCPS part 1, my dear, how can you pass primary FRC? You think it is easier than FCPS part 1? Not at all. I can guarantee you, if someone is not able to pass FCPS part 1, how can he even think about passing primary FRC? Be realistic. But do you think it's a joke? No. It is just like you find an escape. You are trying to have an escape. If so that people who are in Pakistan, if they are doing less than 40 years MCPS, I'm really sorry, they are trying to destroy their career. Because after some time, there will be a cart going with the anesthetist sitting on it. In Pakistan, there is so much saturation. So if you are MCPS, you are nothing. Okay, don't take my words in the wrong way. It is for your future. Okay, it is for your future. I listened from one of the supervisor of CPSP. I was sad, I was shocked, I was depressed when he told the people who don't want to study do MCPS, and the people who want to study do FCPS. If the people who want to become a doctor come technician, they do MCPS. Okay, so please just try to understand. Now it's an era of speciality. Even if you think that you have to go to a periphery doing MCPS, you want to kill the people with limited knowledge, limited concept. Anesthesia is not a joke, believe me. Anesthesia is serious business. And you, even if you are doing ASA1 to patients, you should have the clear concept. So I'm really requesting all of the juniors who are trying to pursue their career on the basis of MCPS, try to think about what they are doing. FCPS part 1 is not difficult if you are preparing just like USMLE. Okay, even if you claim, if the people will say that no sir, we have this stupid sort of MCQs coming, I will use a word. I have never seen a rabbit going to eye specialist, and the link is carrot, because rabbit is always eating carrot, so his eyesight is very good and he's never going to eye specialist. So similarly, I have never seen a person who is preparing for USMLE failing in FCPS part 1. Simple as that. They are not reading this scrap material, still they are not failing in FCPS part 1. Is exam different for them? Is CPSP give them red carpet that you are preparing for USMLE, so we will give you separate paper? Why? How they are passing this exam? Because they are having clear concepts. Okay, and the people who are from different part of world, I request all of you, or I suggest all of you, because my time is finished. I don't I know nobody told me these things, and I never think about it, unfortunately, but that's why I am speaking loud and clear to all of you. All of you should have Kaplan first aid with you, and try to correlate whatever you are reading, especially physiology, pharmacology, anatomy, okay, pathophysiology, medicine, surgery, pediatrics, okay. You exclude the terrible subjects, biochem, some of the concepts of biochem, genetics, okay, psychiatry, behavioral science, maybe you can exclude embryology, okay, histology. These subjects you can exclude, but 5-6 subjects, the chunk, if you make yourself equipped that you are reading your subject and you are correlating it with what is written in the USMLE books, you will have crystal clear concepts. So this is a message, this is a request to all of you to read these books together, only maybe just a glimpse, and you will have clear concepts, because USMLE is one of the best exams in the world. If you want to check out your knowledge, clear concepts, it's a hell of exam. And because I have discussed this topic a number of times before, if you have done USMLE after your fellowship, you can apply for fellowship program. Yes, it is very difficult, still difficult, but it is better than UK and Ireland. It is more difficult, you can say, but it is more definitive. If you have done USMLE, just you have to pass, you will get the ECF MG, okay. And yes, you should have some research work with you. If it's there, it will be easier. If you have a good communication skills, you are applying. A number of friends who have done FCPS, they went to US for fellowship, and they are become a gem. Because I have discussed this topic before, you can do 4 fellowships, and then you can become consultant in US. Or if you are good enough, even after first fellowship, they can transfer you to residency. And so if you want to know, the best thing in the world is residency in US. Okay, because you will not get a job like in UK and Ireland of only donkey work without any reward there. Either you are able to get it, or they will not let you come there over there. So there is no gray area in US. Either you will able to get it, or you will not be able to get it. But still, of the residents, if they are trying to do in their residency, they are very active, they are very agile. If they want to have their career in a better direction, all of you, I request you to have, just keep a taste of USMLE with you. Okay, even at age of 42, believe me, I have USMLE books at my arm distance. Unfortunately, because I'm involved in so many things, running after you, I am unable to do it. But it's in my wish list to do USMLE and to go for a fellowship in US. Not to, I will not get anything much. But the thing is that I have worked with US trained people. And in my opinion, again, due apologies for the people who are trained in UK, Ireland, there is no comparison between US system and this British system and Irish system. They are much superior. That's why they are the superpower. Okay. So I have spoken my heart out. The question from Rabila Iman Hashmi in Saudi Arabia at FCPS, fresh FCPS is senior registrar. People from India, unfortunately, they are not able to get any book. They like people from Pakistan who have done MCPS, or the people who are from India, MD or DNB, they are maximum registrar. They cannot become consultant in Saudi Arabia. Okay, they are maximum registrar, and maybe they will finish after some time. I'm not sure, because there is so much competition going on. Fresh FCPS is senior registrar, and after 5 years, you become a consultant. After 5 years of your FCPS, you become consultant. DNB, MD, they cannot become consultant in Saudi Arabia. Okay. Similarly, and the jobs are getting much more difficult. There is Saudization going on. So after some time, it will be very difficult to get job in a better cities. Only 3 cities are perfect for living in Saudi Arabia: Riyadh, Dammam, and Jeddah. Rest of the cities, you will struggle. Yes, if you are a newly married couple or you are coming alone, you can go any part of Saudi Arabia. You can stay there, but there is no direct flights. Direct flights is only from these 3 cities and also from Medina. But actually, if you want to have a perfect match, only 3 cities are worth. All other cities are very difficult to survive. If you are with family, there will be no schools and you will have a lot of problems. So I never suggest anyone. Yes, if some people say we will come, we will stay alone, this is abnormal. This is abnormal. Never leave your family. Life is for once, and it is not for wasting your time alone without your family just to save money, and you are not sure whether you will be able to utilize that money or not, because life is unpredictable. Okay, so I will never suggest anyone to destroy their family life by coming alone. Okay, so PLAB is a 2-year journey approximately due to lack of seats. Yes, this is, this is something else, no problem. Okay, MCPS trainee is, and you should, did you ever think what you are doing? Okay, so the thing is that if you appear, and another thing is, people who are scope of FCPS is nothing in UAE. That's what I asked my dear, holy, respectable friends and CPSP. Have they ever tried? Unfortunately, they are busy in building their ego. Unfortunately, they are making big institutes. They are making beautiful websites. They are wasting their energy. And ask them what they have achieved in last few years. Only they are losing. UAE, you have no future. FCPS, fresh FCPS is nothing. You are not eligible to appear as register as a specialist. You have 3 years. After that, you will become specialist and you will die as a specialist. You can never become a consultant in UAE, neither in Kuwait, neither in Bahrain, neither in Oman, neither in any Gulf countries other than Saudi Arabia. I don't know how Allah saved our degree in Saudi Arabia. Okay, this is just a magic. This is unfortunate. Fortunately, this is not anything to be done by CPSP. If I listen that CPSP is able to recognize our degree in any Gulf countries, I will be very happy. They are losing the exemptions which were there. FRCA primary exemption was there till 2011. And because the beautiful brains in CPSP never applied to get that exemption finish, unfortunately, or they have not done serious efforts, or they have not pursued it in a proper way, unfortunately, that exemption is finished. And I'm telling you, I'm warning you, because you people are very happy. Oh my God, we are so lucky, sir. You are telling us stories. Sir, recall paper comes in 80%, 80% from recall paper. Okay. So why should waste our energy in studying good stuff? Jamil, you may be right. In Kuwait, same criteria for FCPS. How many consultants you see in Kuwait? Did you find any consultant who became on the basis of FCPS in Kuwait? Recently, it is open, because unfortunately they sent a lot of Indians back. Okay, they sent a lot of Indians. I don't know what was the reason, but a lot of Indian consultants were sent back and Pakistanis were allowed to come. Okay, and majority of them was in Corona time. And ask them how is their working conditions over there. Okay, anyways, anyone see, I will be very happy if you share the classification guideline. If it is showing FCPS as consultant, I will be very happy, but it is not there. Bahrain, I am sure I saw the classification paper from Bahrain. It is not there. Egyptian degrees are there. In UAE, you can become consultant on Egyptian degrees. Indian degree, I'm not sure. Indian, I think they are also a specialist. FCPS is nothing. They can never become consultant. Okay, so anyways, I think I have taken enough time. Please speak out. Go to CPSP. Talk to the supervisors. Don't be afraid of them. They cannot kill you. What maximum they will do? Already, what are they doing to you? Are they telling you these things? This is not my job. Believe me. And I'm not saying it. This is the responsibility of the supervisors back in your country to tell you all the future perspectives. Whether you are in India, whether you are in Africa, please, I'm sorry, I'm using a hard word. It is because of you they are having this rod in their necks, because you people are afraid of them. You are not making them work for the responsibility they are enjoying. Okay, it's they are enjoying. They are there is no doubt. Especially I'm not sure about India, but I'm sure about Pakistan, because unfortunately they are thinking that they are doing something nice by becoming a supervisor. Unfortunately, no, it's a responsibility. Okay, if they want to enjoy the position of assistant professor, they have to they have to do the maneuvers. Yes, I don't care. I don't care. I'm speaking out the truth, and I don't care, and it's not for my benefit. I'm out of it. I'm out of it. Unfortunately, they don't have any answers. When they don't have any answers, they start showing the grudge. They say to me, come back to Pakistan and work here. Okay, I said, I'm sorry, I'm not this, I don't have the stamina. I don't want to be a photographic professor. I don't want to only have the this cake cutting ceremonies. I'm not supposed to do that. This is not the real life. I don't want that hypocrite life. I'm so unfortunately. And the reason is these sleeping ducks. I'm sorry, I'm using this word for you people. It's your problem. Why are you speaking? Why are you sleeping? I'm asking you to all my residents back in Pakistan, why they are sleeping? Why they are not asking, sir, what are you doing? What is CESR? What is CCST? What is, why have you made it all MCQs pattern? The pattern is not there in FRCA. The pattern is not there in FCI. Why have you make it? And I get a very good example. We are following the pattern of America. They don't have all MCQs pattern. My dear friends, they have USMLE exam to enter in the residency. They twist the necks of the people who are trying to enter in the American system via residency, and they filter the people who are able to get the residency in US. They are not ordinary people. They have read all the bloody things in USMLE. They have clear concept. They have no doubt. And then they have work-based assessment. Is there any work-based assessment? Work-based assessment, they need to be in the operation theater. How many, except, again, I tell, exceptions are always there. My words are not for the exceptional people who are helping others. My words are for the people who are sitting in their air-conditioned rooms and they are thinking they are doing a great job, who are posting pictures on Facebook and very happy and very satisfied. And the resident is suffering. They have recognized the institutions who have only ability to have 6 months rotation, and they have recognized it for 4 years training. Ask yourself, how can a cardiac institute become recognized for 4 years training program of anesthesia? How can a pediatric hospital be recognized for 4 years training program in anesthesia? How can a kidney or liver hospital be recognized for 4 years training in anesthesia? These are the dark sides. Nobody, I'm really sorry. I'm really sad. And they say, no, we send the people for rotations. Ask them on oath. Are they sending the people honestly? Are the people who are doing training in NICVD or Multan Institute of Cardiology or Punjab Institute of Cardiology, are they getting the free the same exposure as the person who should have, who's working in Aga Khan or who's working in Shifa International? At least give them fair chance. This CIP and this was done by our holy Sharif family, who destroyed the played with the careers of the people by making this central induction policy. This was a crap. This was totally unfair. So anyways, I'm really sorry. This is my weak point, and all my words are for you people. But unfortunately, I'm trying to call Dr. Khalid Bashir. I'm trying to call Dr. Gohar Afshan. I'm trying to call Dr. Leena Aziz. I have talked to a number of people. I am trying hard. But if you people are very happy, you are very, very happy to have IMM passed and running for CPSP scholarship, I'm afraid you are on the wrong bus. You will suffer throughout your life. Okay. So this is my message. And even I'm sorry, because my main listeners were, my main point was that one. I request all of you, please don't hesitate to ask questions. Please don't hesitate to ask questions. Ask them, because they are supposed to answer you. Because when I was a trainee, they used to answer me, please read and we will discuss. Though, so the people for India and Pakistan, na nauman tel hoga, na radha nachegi. You will never have 9 liters of oil. On that, the lady will dance. Because if you make such criteria that a lady will only dance if you bring 9 liters of special oil. So it will never happen. Okay. They are supposed to look at you while you are working in the operation theater. Call them and become besti proof. Don't listen to their hard words. Let them come to you in the operation theater. They cannot train you via satellite. They have to be on your head. Ask them about the future prospects. Ask them what is CCST? What is CESR? How to get into the training program in UK? How to get into the training program of Ireland? Ask them, please, sir, this is your responsibility. We want to listen from you, and don't be afraid. Don't be afraid. And last point regarding the equipment's availability, I request all of you, go to CPSP, ask them, take extra money from us. They are taking, by the way, from the fellows, they are taking a lot of money, and I don't know what they are doing, except for buildings and buildings. They should make simulation labs where all the requirements which are there for any resident, like fiber optic, ultrasound, it should be made by regional training centers. And as they are making it obligatory, they should make it obligatory, and it is 100% possible. Don't tell me that it's not possible. It's 100% possible. They can have workshops. They can arrange. It should be arranged by a CPSP. And College of like the anesthetists who are involved in it, they are responsible for it. They should do it. There is no explanation. They are making supervisor like anything. But what are they getting? They make, when I ask some of the faculty member, sir, why you converted to FCPS on MCPS on an IMM on total MCQs? They had no answer. They said, because people are not giving, we have made a decision and it is not our fault. And this was done by the college, and now people are not giving, preparing MCQs. I told, sir, it is not easy to make MCQs. And if you know that what is the mentality of our part of the world, it is very difficult. The people who are making the quality pools, they are investing a lot. They are paying a lot of money to the people who are preparing the MCQs. It is not like that a person is running to the private hospitals doing double jobs, and even as a consultant, they are struggling a lot. And you are asking them to make FCPS, MCPS, MCQs. I'm really sorry. You are totally wrong. And then another reason is that you are making your degree different from the degrees which are actually you are getting exemption and your people are going. Just like primary FRC exemption was finished, very soon FCI exemption will be finished. So wait for it. Wait for this thing to happen. Okay. So biryani box. Yes, you are absolutely right. So workshops are for biryani. And I apologize if someone listen or someone quote me. Please don't go half-cut words, just like half-cut words of Imran Khan is being quoted, and Imran Khan is being taken to the jail. Okay. They are trying to, so don't take me to jail on the basis of these things. I'm speaking out the valid points, and don't destroy your career. Think logical. Don't go for shortcuts. There is no shortcut to glory. Okay. So any other question? Because, you know, people are messaging me sometimes asking about FCAI, asking about FRCA. They are not listening to any of the discussion. And then I have to answer them, and then I tell, please go to the YouTube channel, and I have discussed these things a number of times. A number of times in the career counseling session, I have spoken out a number of things. This system can only change if you go. Don't be afraid. Don't be afraid from them. Go there, ask questions. Okay. Only then you can get something. Okay. So thank you very much. And any question before we finish? The bottom line is that even if you are thinking that you will get something out of the world from CPSP scholarship, there are a number of advantages. But overall, if you ask me, it is not worth you. You should wait, finish your training, pass your exam, and then go wherever you want to go. But don't try to bypass. In that time, invest your time in building up your knowledge, building up your knowledge, building up your knowledge. Okay. Thank you very much. Anesthesia residency in USA from after FCPS part 2, it is very difficult. You have to pass the exam. Still confused whether giving primary FRC is an option post FCPS if one has GMC. Yes. No. There is no guarantee, my dear. That's what I'm telling you, Mr. AR. That's what I'm telling you, that people think that if you pass the exam, Boris Johnson will come, or this president or prime minister will come to give you training. Not at all. You will have to prove them that you are worth. The exam is nothing. The gentleman, you have passed the exam. Okay, now compete for the training first, and then we will get you trained. It's like that. Please highlight role of FRC after FCPS. There is no role. Okay. So remember one thing, that FRCA degree exam system is separate. You have to ask me how to get, ask me what is the advantage of CCST. Exam is nothing. Exam passing FRCA is nothing separately. Okay. So this is my whole point of view. I hope I answer your question. Can you speak out? What do you exactly want to ask? Mr. AR, please. The question was asked before by whom?
I think I have mistakenly sent that question to him instead of the common group.
Okay.
Ripa here, sir.
Yes.
I just wanted to ask whether giving FRCA is the route to getting training in UK. If it is not, then definitely there's no role of it.
Rifa, that's what I'm trying to tell you. That's what I'm trying to tell you, that mind it, MRCP, MRCS, people were earning a lot throughout the world. These Royal College examinations, they opened the door. These European people, they opened the door very late. And now everyone is running after European diploma in anesthesia and ICU. Everyone is running after. This is nothing. When I was appearing in European diploma in anesthesia and ICU exam, after that, I just asked, it was in Turkey. So I asked him, sir, whether I will be able to enter into, and I really liked Turkey. So I asked him, can I get a job in Turkey? He started smiling. He said, no, you will need to pass, you will need to have the language. Okay. So similar, same is our answer for you, Rifa. There is no guarantee. They make things very open. They will test you. The exam is only you can say peanuts. Okay. This is just one formality. There is no guarantee that if you pass FRCA, because there people will also be passing the FRCA exam, or hundreds of people will pass a primary FRCA exam. Will they able to give training to everyone? Just like in Pakistan, everyone who is passing FCPS part 1 without any aptitude test, without any check of pure knowledge, without any assessment, we are getting the training, unfortunately. And then we suffer a lot. And then this intermediate module, at that time when I appeared, intermediate module was even with written. So we need to know a number of things before passing. And I'm not saying that things were different. Similar question used to come. Same, life was same. But this MCQ pattern is not valid for Pakistani Indian mentality, unfortunately. Because we will look for the shortcuts. We will try to reproduce the questions and try to have a shortcut. Sir, let us pass the exam. Getting knowledge, the whole life is there. This is the answer which I get. And even there are so many people who are selling this point of view. If you want to pass the exam, things are different. If you want to have the knowledge, it is different. There are people who are selling this thing. Okay. And they are destroying the minds of the people. Unfortunately, I have no personal grudge with anyone. but I have special grudge with the people who are trying to destroy the careers and destroy the futures and destroy the mentality. Okay, so please don't underestimate yourself. You can do everything. If you have the will, you can go there, but you should know. And you should, the more important thing during training is not passing primary FRCA, my dear. More important thing is to know what is being asked in primary FRCA. What is the knowledge you should be knowing. And even if you don't pass the exam, it is just matter of time. It is just like entering in their party, and you will be able to, it will be nothing for you if you know how to study, if you know how to manage the things. And that's what I'm trying to do whenever I'm taking any class. Okay, I'm not having any benefit. I don't want anything in return. Whatever I'm telling you, even whatever topic I discuss, I only try to tell the main important points, because all of you are intelligent enough to understand. The only problem is that if you have this thing in your mind that you have to see the exam through only, and you are not understanding the point that if you know the knowledge in the proper way, then there will be no 50-50 chance. It will be 100% that you will pass, inshallah. But if you are in between, people who are following one simple book, unfortunately, they have a tunnel vision. Okay. So thank you very much, all of you. Inshallah, we will meet again. Bye-bye. Dr. Shumaila Motiwala, I will answer your question before I close the discussion. Nothing. For Gulf, you need CCST. If you have not listened the discussion from the start, please go back. I will put it on the YouTube. Open the YouTube and listen to it. You need CCST to become a consultant in UAE. Okay. Thank you very much.